Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. This is a part of a discussion series focused on back-to-school community resources. We're talking with state agencies who work to support youth and families in Delaware. But before we begin, I'd like to give you a little bit of information about NAMI Delaware. NAMI stands for National Alliance on Mental Illness. We are the Delaware chapter of the national organization, which is the largest grassroots mental health organization in the country. There are NAMIs in every state and hundreds of them across the country. So if you're viewing this video today from outside of Delaware, you can find your local NAMI by visiting their website, nami.org. NAMI Delaware offers support, education, and advocacy to those affected by mental illness. You can learn more by visiting our website. And there you can also see mental health related resources that are available in our state. You can click the Education tab and then Resources. NAMI Delaware is not a crisis response agency, but we do want to be sure you have access to crisis response should you need it. You can either call the Delaware Hope Line at the number you see on the screen, or you can reach out to the National Crisis Text Line by texting DE to 741-741. Today, we're talking to Sarah Robbins from Jewish Family Services. Welcome, Sarah.
Thank you. Hi, Annie.
Hi, thanks for being here and for taking a few minutes of your time to talk a little bit about your work at JFS. Let's start with your role and maybe a little bit of your background.
Sure. So I am a licensed clinical social worker at Jewish Family Services, and I work in an outpatient setting, and I specialize working with children, adolescents, and families. I went to Smith School for Social Work for my master's degree, and I've been working as a licensed psychotherapist since 2016. And I have extensive training in family therapy and cognitive behavioral therapy modalities.
Wow, that's great. Thank you. So I'm sure COVID has played a part in your most recent, like 18 months, right? It's been 18 months, if you can believe that. And it's certainly affected everyone in all walks of life and certainly the way we do our work. Has it made any changes in the delivery of your programs at JFS?
Absolutely. JFS has worked really hard to make sure that we continue delivering effective services. So one of the main things that we've done is we switched over to providing telehealth sessions to our clients, and that has included individual sessions, family sessions, parent skill training, group sessions. So that has been kind of the big shift in the way that we've changed the modalities. We are moving back to in-person with certain protocols in place, which I know a lot of people are excited about, especially when working with kids and teens. It's important to kind of have that kind of one-on-one quality time. The other thing that we've done is we have initiated some new programs that I do want to share about.
Sure.
Well, the first one is Helping the Helpers, and this really started right when the pandemic hit, and it's designed to provide a space for professionals who are helpers in the community, doctors, nurses, social workers, therapists who are experiencing burnout fatigue. And there's a lot of teaching on mindfulness and wellness. And so this has been a really kind of great program for helpers in the community who are experiencing the exhaustion of this pandemic. With all of the ones I'm going to talk about, you can get more information on the website. But that has been one program we've started that has had a lot of really good feedback and good attendance. The next thing that we have started is we've partnered with Cancer Care Connection. And this is a program dedicated to helping individuals and their loved ones navigate the full issues that they face when they're affected by cancer. So this is a new program, a new partnership that we've started. Again, we've had some really good feedback. And if you have more information or you know somebody that could benefit from this type of partnership or program, I would really encourage going on the website and getting some more information. We've also launched the Sonia Shore Maternal Mental Health Program, which is designed to provide effective and evidence-based psychotherapy for women experiencing perinatal mood and anxiety disorders. So again, kind of, I realize maybe not so much for kids and teens, but mothers.
Sure.
Who are experiencing, perinatal, postnatal, postpartum depression, and anxiety. And the last program that we are just now starting is some clinicians at JFS are going to be receiving specialized training in an evidence-based model called the coping cat. And this is a specific manualized treatment to address and treat anxiety in school-age children. So we're really excited to get clients and parents to kind of come in and work on anxiety, because we know that there's been a significant increase. So we are going to be looking for referrals soon for this.
That's good to know. And you can see the information on our screen, and I'm sure we'll have them attached to the videos too. Those are great programs. It sounds like you've really thought it out in a complete way, thinking of the whole community and the whole family.
Yeah.
But this discussion series is focused on back to school. So I think that last program you mentioned, the Coping Cat, is a great segue into my next question to you, which is, what do you see as a priority right now with regard to back to school?
Yeah, great question. So our priority is really just supporting the kids, supporting the caregivers. You know, as I've mentioned before, and I'm sure people have seen, there's a significant increase in anxiety with children and teens during this pandemic. And so as we transition back to school, we're going to be navigating new rules, new protocols, relearning how to socialize again. We're gonna see even more increased stress and worry. So our priority right now is to provide parents, caregivers, teachers, support staff, and of course our clients with education and tools to manage this transition and cope effectively with the uncertainty of change.
Yes.
You know, one of the most important things that we talk about as therapists is, how can we sit with the discomfort? How can we express the discomfort, and how can we accept the situation and the unknown? A lot of times when I work with kids with anxiety, all these worry thoughts, we get into these thinking traps. I can't control this. I can't fix this. And we have to do a lot of work to just breathe through it and understand we can't control it, but we can be resilient and we can deal with the adversity. And so our priority is really teaching that, giving some skills, and just really being supportive for these kids and these caregivers, because it's a really stressful time. And I think everyone's pretty overwhelmed with this.
I would agree. I would agree. Not only that young people need that added support and the caregivers involved in those young people's lives at home, but also educators, right? And what's going on in the school settings. And as you mentioned, the changes in protocol and the changes in the way we need to do education safely, right? And really, I think JFS has a program. You have school-based therapy, right? So can you tell a little bit about that? That might be a good time to talk about that.
Yeah, absolutely. So we do have school-based therapy. They're called family crisis therapists, okay. And they short-term FCTs, and they are located in different elementary schools in the state of Delaware. And right now we are in 3 elementary schools: Silver Lake Elementary School, Marbrook Elementary School, and Shortledge Elementary School. And the FCTs, they have a wide range of responsibilities. They do home visits, they work in the classroom, they lead social skills groups, and they also work with students individually. And really, their goal is to collaborate with everyone: parents, the school, teachers, and help the kids adjust and navigate change, deal with difficult emotions, behavior problems. It's a really interesting position because you get to kind of be present in all different parts of this kid's life,
sure.
And in the school and the community. You know, I have collaborated with a few FCTs, and they're just really wonderful clinicians with great training. And I think most of our FCTs have been at that school for a long time. So they have really good rapport at the school. So it's a great resource if someone who is listening has a child at one of those elementary schools, to seek out those services. And I'm pretty sure students can access services throughout the school year, and I think into the summer as well.
Oh, that's great.
Yeah. So it's a really wonderful resource. And I know the FCTs really kind of just love their job, and they feel pretty valued in the school.
Yeah, sure. It sounds like they're sort of the glue that holds all of the environments for the child together. Right?
Yeah.
They're interacting with every sort of part of their life. That's great.
Yeah.
So you also have something called play therapy, which was certainly intriguing to me because I want to hear about that. Anytime that you can involve play, I'm in. What is that?
Sure. So play therapy is a treatment modality typically appropriate for kids ages 3 through 12.
Oh, darn.
I know. Although you know what you can do with adults too. You just have
Okay.
to kind of get in the mindset of
But
it.
it sounds so great. And I think for a young person to even just hear about that would be
Mhm.
probably like, ooh, I want to do that.
Yeah.
So what's
So
it for? Like,
yeah.
how do you do that?
So kids, they communicate through play.
Mhm.
Right? That's how they express their feelings. And so one thing that we have found at JFS and in other organizations is that we have a playroom designed for kids to come and express their feelings, deal with their problems, navigate situations through the language that feels natural and developmentally appropriate for them. So one thing that's important, though, is it does require a trained clinician who is trained in play therapy and can understand what the modality entails. And so, we look for themes, we look for conflict, we look for kind of different ways of expressing different emotions. But typically the kid will come in and you will kind of guide them in a play session, and they can pick different things that they want to play, whether it's a dollhouse or arts and crafts or puppets. Sometimes you'll even use a sand tray and do sand tray therapy, and we'll identify different themes. What I have found is that I have kids who are a little bit younger or maybe not as verbal, and they will just express so much through their play. And then they leave feeling like, I got it out. Just like an adult who maybe comes in and lets it all out. And then it's like, okay, I let it all out and I can go back now to my environment. So it's a really wonderful modality for kids and, tweens maybe who are a little bit less verbal.
Sure, that sounds great.
Yeah.
So we've talked a lot about the programs you have serving children, but I want to talk a little bit about parents and caregivers. You've addressed a little bit of that, but what kind of message do you have for them when it comes to knowing when to seek services or what to do if they're concerned?
Right. So one thing I really want to, give the message to parents is this is a really challenging time, and everyone is going to be experiencing heightened stress, heightened anxiety that has come with this pandemic. I mean, the isolation, the uncertainty is going to take a toll on you, and it's going to take a toll on your kids. So with that being said, I really want to encourage you to really listen to your kids and let them know that what they're feeling is okay. With that being said, it is important to kind of keep an eye on some behaviors that might be a little off. Given that it's been 18 months, your kid has experienced isolation. Your kid has probably not been with social friends in a while. If you're noticing that they're isolating even more than normal, that they are talking about feeling hopeless or helpless about the future, if they're making comments about wanting to die or cutting or harming themselves, if they're struggling with friendships, if they're struggling with academics, if they're having significant behavior problems at home or at school or in the community, these are kind of warning signs that there's something more significant that we want to get some extra help. But really, I want to kind of focus on, is this a shift that is more significant than you have seen over the past 18 months, right? So trying to assess, is this just kind of typical pandemic kind of lethargy and fatigue, or is my kid really struggling and we need to get professional help?
Yeah.
A lot of times what I'm seeing is that the kid just needs to know that they're going to be okay and that what they're feeling is normal and that they're going to be able to handle it. And I do a lot of work with parents in just saying, we're going to get through this together. And the more that the parent can be confident and secure in that, the kid is going to be more confident and secure in getting through.
Sometimes it's just a matter of the parent or caregiver validating the young person's concerns and letting them know that they get it and that this is a hard time and I'm feeling it too, and that kind of thing, because perhaps they feel, like you said, they might think they're the only one who's feeling this way.
Right.
And
And
you
so,
can remind them, that's great.
yeah, and I work with just so many parents who feel so stressed about, is everyone okay? Is everyone okay? And I'm like,
Right.
no, not everyone really is okay.
No, it's a pandemic.
And that's okay. It's okay to not be okay right now. And can we just talk about that and acknowledge it, and then let our kids see, hey, we're all struggling, but we can struggle together. You're not alone in this, and there's nothing wrong with you.
Right. We're responding in a human way to very unreal or just surprising circumstances that we would have never guessed would happen. Right.
Absolutely.
Yeah. I mean, we didn't certainly know this was coming. So
no, we did not. And you would think that after time we would get used to it now, but now there's another change, and we're going back to school, and you know, and it's going to change again probably in a few months. And you know, and so it's really just, how do we learn to cope with change, constant change?
Yeah, you mentioned earlier the uncertainty piece, and I think validating for anyone that you're helping, whether they're a child or an adult, just to remind them that, yeah, this is a weird time, and like you said, you might not feel okay, but most of us don't.
Right.
And it's okay, and the uncertainty is something we need to just try to get through together. That's such an important message.
Yeah, and the other piece that I've really been working through a lot with families is the loss and the grief that has come with this time, and just the lost opportunities, and you know, the lost kind of experiences.
Right.
That, you know, kids are
life events, significant life events may have not even happened in real ways, graduations and those kinds of events. Sure.
And so really, you know, looking at expectations that kids are going to be sad, kids are going to struggle, and we have to be okay with that. We need to really normalize that it's going to be challenging, and also we can do it together.
Sure. And I would suspect this time of transition back to school might be especially challenging. Is there anything specific to message around that for parents or caregivers?
Yeah, I mean, I'm all about open communication and collaborating. You know, your kids have ideas on what's going to work for them. Talk with them about it. Set a schedule that feels good for them and for you. Be flexible, and have conversations about other things. You know, not just how's school going, right? Like, what is your kid into? Is it Minecraft? Is it Legos? Is it something else? Like, have conversations about things that they're interested in talking about, and don't focus so much on behavior and academics in school, because most of the time kids don't really want to talk about that. And again, like I was saying before, just really reassure your kid or your teen that this transition doesn't have to go perfectly, and that it's about the ability to communicate kind of what's going on, and navigate the change, and build up resiliency, and deal with the adversity, and that it's okay that it's difficult, and just to have realistic expectations about what this transition is going to look like, and really what this year is going to look like.
Sure. Third school year being affected by COVID. It's hard to believe, but it's true. So, well, you have shared so much great information. If people want to know more, what's the best way to reach you?
Sure. So our JFS website is, jfsdelaware.org. Wonderful website, very up to date with all information, and different contact information for the programs. I also can be reached directly. My email is srobbins@jfsdelaware.org. That is also located on the website. So if you missed that, you can go on and just look for Sarah Robbins. I'm happy to answer any emails. But really, the website's just wonderful. It's perfect. Yeah, it's great. Great website.
Awesome. Thank you. Well, before we wrap up, I want to ask you one more question. And this is a question I'm asking everyone who's doing this discussion series with us. And it's really focused on what your message is to our viewers when we think about back to school and our third year being affected by COVID. What's your message for those watching right now?
Yeah, just take it one day at a time, one moment at a time, 1 hour at a time. Don't put pressure on yourself to make it perfect. Be compassionate, be gentle. This has been a really rocky 18 months, and it's going to have a long-term impact. And so I just really encourage people to take their time and to take care of themselves so that they can take care of their kids. And to really just be patient. It doesn't have to be perfect. It doesn't have to go smoothly. It might be chaotic, and that's okay.
And that's okay. I love it. Thank you so much, Sarah.
Yeah.
It was great talking to you. I hope you'll come back on this again.
Yeah, thank you so much.
All right. Take care. Bye-bye.
Bye.